Guys, let me tell you something serious. Did you know that your prostate might be showing clear warning signs and you haven't even noticed? That's right. A lot of men out there are ignoring symptoms that could indicate serious problems. And look, I know this topic is still taboo for many people, but the truth is that most men after the age of 40 start to experience changes in their prostate. Knowing how to take care of it can make all the difference to your health and quality of life. So if you want to avoid inflammation, discomfort, and even more serious risks in the future, stay here with me until the end. Today, I'm going to explain everything you need to know about this topic, and while you're at it, tell me in the comments, have you ever had a prostate exam? Or do you still have questions about it? I want to know the role of the prostate and warning signs. First, let's understand. The prostate is that tiny gland about the size of a walnut located just below the bladder. It plays a super important role in the male reproductive system, but as time goes by, it can increase in size, and that's when those annoying symptoms that many people complain about start: difficulty urinating, getting up several times during the night to go to the bathroom, feeling like your bladder never completely empties. And if we don't take care of this, the situation can get worse. It can turn into prostatitis, benign, prostatic hyperplasia, and, in more severe cases, even prostate cancer. So it's no joke. The sooner you understand what's happening in your body and start taking action, the better the role of ejaculation in prostate health. Now pay attention to this. Did you know that frequent ejaculation can help your prostates? Health sounds curious, right? Well, a study published in the European Urology Journal showed that men who ejaculate about 21 times a month have a lower risk of developing prostate cancer. This happens because ejaculation helps clean the prostate, eliminating substances that can build up and cause inflammation. But hold on. That alone won't solve everything. Got it. Ejaculation is just one of the factors. If you don't eat well, don't drink enough water, and never get exams, it's no use. The secret is balance, 3 changes in the prostate after 40, and how to deal with them. Now, let's talk about the 3 most common changes that happen to the prostate after 40 and how you can minimize their impact. 1. Increase in size and fluid accumulation over time. The prostate can grow and start to retain more fluids. This causes that feeling of heaviness, discomfort, and even inflammation. To help with this, maintaining good hydration and an anti-inflammatory diet makes all the difference. 2. Hormonal changes after 40. Testosterone levels start to drop, while the hormone dihydrotestosterone (DHT) can stimulate prostate growth. The best way to deal with this is by exercising regularly. Physical activity improves circulation and helps regulate hormones. 3. Higher risk of cellular changes over time. The risk of cellular changes in the prostate increases, and that's where routine exams come in. No excuses. You need to get a digital rectal exam and PSA test at least once a year, essential care to keep your prostate healthy. Now that you understand the changes that happen to the prostate, let me tell you what you need to do daily to keep everything in order. Annual checkup starting at 40, going to the urologist for an exam is essential. The sooner you detect any problem, the easier it is to treat. Right diet. Avoid red meat, fried foods, processed meats, and industrialized foods. Opt for vegetables, fruits, and healthy fats like avocado, nuts, and olive oil. Oh, and a little secret: tomatoes are great for the prostate. They contain lycopene, which helps protect the gland cells. Physical exercise. You don't need to become an athlete, but you do need to move. Walking, weight training, and even specific exercises like Kegel exercises help strengthen the pelvic muscles. Drink plenty of water. Staying hydrated helps the urinary system function well and prevents inflammation. So grab a glass of water. Right now. Men, stop being ashamed. Take care of your health. Now, let me say something serious here. Men need to stop being ashamed to talk about this. Many people still avoid the subject, don't want to go to the doctor, and refuse to get exams out of pure prejudice. And this only makes things worse, guys. The digital rectal exam does not affect your masculinity. What affects it is neglecting your health and letting a simple problem turn into something much bigger. If you care about your quality of life, be responsible for your own body. Taking care of your prostate is not silly. It's not an exaggeration, and it's not optional. If this video helped you in any way, share it with your friends, send it to your family group, because this topic needs to reach more people. Leave your like, subscribe to the channel, and tell me in the comments, have you started taking care of your prostate? Yet also rate this video from 1 to 10, so I know how important this video was to you. I want to know. And don't forget, prevention is always the best medicine. Thank you so much for watching, and I'll see you in the next video.